24/7. 24/7.
Bold Moves Radio.
Bold Moves Radio.
Afrika nakupenda sana. Oh, Afrika nakupenda sana.
You are listening to Bold Moves Radio. The show is Prudent Woman with myself. I'm Rhulani Baloyi. Thank you for joining us. As always, we come to you every Sunday from 4 o'clock up until 5 o'clock. This is Prudent Woman, and we say we spark conversations that we should talk about things as women and be able to make intentional decisions as prudent women and make sure that we improve the quality of our lives and the lives of our loved ones. This afternoon, as always, I do not come all by myself, but I have our doctor, Dr. Sekhaolelo. She's here joining us. She's a gynecologist. You will hear as we continue the conversation. I'm sure most of you are excited. As Prudent Woman, we've never hosted any gynecologist, but this afternoon we'll bring to you our wonderful doctor. And we'd like to say thank you for joining us and taking your time to come and educate us, empower us with knowledge so that we can take intentional decisions about our health. If you are listening to us via our Facebook page and our YouTube page, please go ahead and be part of this conversation by dropping down your comments, your questions to our wonderful doctor on the platform. If you are listening to us via our Bold Moves radio streaming, you are welcome to join the conversation by sending through your WhatsApps to 081 358 8745. The number is 081 358 8745. As we always say, we appreciate you joining us because this will not be a conversation if you are not with us. And we are excited for this afternoon. We will be empowered. And the topic of this Sunday, we are talking on a very important topic, which has got a lot of myths that tends to make us be so fearful because of the negative connotations around it. That is menopause. I know those who are still young, you have heard about it. You have a lot of myths around it. Those who are old, some of you have heard about it, and you may be experiencing it. And at times, the way this has been talked about, we talk about it or we experience it, but you still expect that there may be something else because of the myths around it. And that's why, as Prudent Woman, this afternoon, we saw it fit. Let us talk about it, even as we continue and celebrate the month of heritage, as we are going to get on the 24th. And we believe there's a lot of things associated with medical issues and at times tend to be more culturally aligned, more about our heritage. Certain things we say we do not talk about them. And this afternoon, we have Dr. Tshegofatso. We're going to talk about menopause. Welcome, Dr. Tshegofatso. We are excited to have you. As I said, you had our first lady gyne who has joined us. Before we started on the conversation, we were talking behind the scenes with Dr. Tshegofatso. I said to her, why is it that there's a lot of male gynes than female gynes? Dr. Tshegofatso, I will invite you. Please greet our audience. Maybe some of the people who are listening to us also have that question. Maybe you can go ahead and answer. Why do we tend to have a lot of male gynes than female gynes? Please greet the audience.
Good afternoon, Mama Rhulani. Thank you for inviting me. I really feel like a prudent woman by just being invited here, you know. Thank you so much. I really appreciate it. I'm an obstetrician and gynecologist. Obstetrician means the doctor of pregnant women, and gynecologist means the doctor of reproductive health of women. So as you can see, it's two specialties in one. It's the only discipline that has two specialties. So as a result, we take care of two people at the same time. We have to be great at multitasking. So it's a labor-intensive specialty because, you know, pregnancy happens all the time. Even during COVID, every other disciplines, orthopedics and the other ones, dermatology, people were no longer consulting, but obs and gynae, nothing changed. Our discipline, everything remained the same during COVID. So I'm a founder of a medical practice called Gynified, which is a practice that aims to give women royalty care and offer a safe space for them to talk about all their health challenges. I'm also a consultant at Mukopani Hospital. I'm also a senior lecturer of Ops and Gynae at the University of Limpopo. So, as you can see, multitasking is in my genes.
Yes.
And I'm very passionate about women's wellness. I'm a great believer in health education. I believe that if you're empowered, you're knowledgeable, you'll be able to navigate through any stage of life.
Mm. Wow.
And there are
You
more, yeah. So that is the reason why there are more male gynaes, because it's a labor intensive, taking care of two people at the same time. Sometimes one is fine, the other one still wakes you up. So imagine if you're still cooking and then we have to leave the house, leave the pots because somebody is about to deliver, you know. The husband may not be happy with it if they don't understand this calling of being an obs and gynae. So that's why we have few. But nowadays, because also our meals are changing, the men know that in the house we have to help each other. So that's why we are able to have more female gynaes because we're starting to have understanding partners who understand that even women get called to do this job.
Wow. You know, just your last remark says to me, as we are celebrating our heritage and our culture in this month of September, we should say kudos to the men who now are able to make women feel like they can take on those roles which are more demanding, like you are saying, because then it says we've got those men who are understanding and are able to give us that space. And these are times where we should celebrate such men and say, we appreciate it, than for us to keep on complaining to say, ladies are limited because of 1, 2, 3, and 4, you know. And we appreciate you. You know, your bio to me says a lot. As women of this country, we are proud to have women like yourselves who are knowledgeable, who go out, who have got in their hearts the interest of the nation, more especially medical practitioners. You know, before COVID, we all never saw it as important because we had never been faced with such a health issue that we believe, you know, is so transmittable, you know. We thought being a doctor, being a nurse, being a medical professional, it's one of those things. But COVID made us to understand the sacrifices that you put in every time. Whenever I meet a medical practitioner, anyone in the medical field, I always never forget to appreciate that because of your interest, you are willing to put yourself first at risk, because I have tend to understand that you are on the firing line. If there's an outbreak, you are likely to receive it than all of us, you know, because when I have a medical problem, I come through to you immediately. And if it's transmittable, we will see it from you. You become the guinea pigs, you know. So it says a lot. Yeah. It says a lot. And we appreciate the work that you are doing for our nation. Of course, I said, today we're going to talk about menopause. Let us start by just understanding what is this thing, menopause?
Yeah. So menopause, in simple terms, it just means menstruation has stopped. That's what it means. Menstruation has stopped. And it's a diagnosis that you only give in retrospect. So you only say somebody's menopausal if they tell you, let's say you ask them, when was your last menstrual period, or when was your the menstruation that you last had? And it's been more than 12 consecutive months that they've not seen periods, then you say this patient or this person had menopause. So you only talk about it in retrospect. And on average, women have menopause around age 51. Most women by 51 years of age, they've reached menopause, but it can start from 45 up to 59. That is the natural menopause. So there are different types of menopause. What I've just described is natural menopause, whereby it just happens because you're getting older. We are guga,
Mm.
which is fine. So it starts around the age of 45 to 59. But we can have what we call early menopause, whereby the women have menopause between the ages of 40 and 45. It's still menopause is still normal, but it's just that they've had it early, just like, starting menstruation. There are some that start menstruation quite early. And
Mm.
then there's what we call surgical menopause, whereby if for whatever reason your ovaries had to be removed by operation, then the hormones that were being produced by the ovaries, they are no longer being produced. So you start having menopause, meaning you no longer have periods because of the ovaries are no longer there. Things that can make people have their ovaries removed are things like cancer, some very complicated cysts. They can end up removing their ovaries and they can end up having menopause as a result of that. So that's called surgical menopause. And then we have induced menopause. That comes as a result of medical treatment. Some chemotherapies affect the ovaries, and then you end up not producing those hormones anymore. And as a result, you don't have your periods and everything else that comes with menopause that we're still going to discuss. And the other ones like radiotherapy, for cancer, they can all affect the ovaries as well, and then you end up having menopause, which means you end up not having periods for a period of 12 months, and then yeah, you're having menopause. So those are the different types of menopause. So you can have the natural one just simply because you're getting old, and you can have the other one simply because of procedures or operations that you've had. You can also have, if you have menopause before the age of 40, we usually
Mm.
call it premature or premature ovarian failure or premature menopause, because we are not expecting women to be having menopause before the age of 40. It's unusual. And most of the time, women who have menopause before the age of 40 is due to medical conditions, other conditions that they may be having, or some autoimmune. Autoimmune means your body start attacking parts of your body. So the body can attack your ovaries to a point that they stop producing all those hormones, and then you end up not having periods and not having all the support you're getting from the hormones. So that's another type of menopause or premature menopause that they can have. And the problem with that is most women at that age, they're still expecting to still see periods, they're still planning their families. Because of our careers nowadays, we plan to have families quite late in our lives. And then sometimes some people, when they're busy trying, and then they are confronted with premature menopause. So
Mm.
those are the different types of menopauses that we have.
Okay. I'm seeing a question here, Doc. Someone asking, you mentioned quite a number of things that may make you go on menopause before your age. Asking when you don't go,
When they're
you don't
busy.
have your periods because you are using certain types of contraceptives. Will you call that menopause?
No, that is not menopause,
Okay.
because you are intentionally stopping your periods. So menopause, we call it menopause when you are not using anything,
Mm.
and your ovaries are still capable of functioning. So if you remove, let's say, the hormonal treatments or the contraceptives out of the picture, and
Mm.
we jumpstart your ovaries again, they will function. But
Mm.
if you are at the point whereby we can't even jumpstart them, like right now, if you get
Mm.
a woman who has reached menopause and you try to give her hormones or whatnot, those ovaries will not respond because they've
Mm.
reached their expiry date, they are no longer functioning. So when women are on contraceptives, they've intentionally just stopped. It's like just switching off a light. You can still
Mm.
come back and put it on. But this one, we are literally, menopause is like ESCOM is completely removed, or the power supply is gone completely. You can't do anything. So that's the simple explanation for it. So that one we just stopping, putting it on hold, and
Mm.
then when you come back, we can still jumpstart, the ovaries will function. Menopause, they are gone. There's nothing you can do.
Okay. Okay.
Mm.
Wow. If you have just joined us, this is Prudent Woman. We are talking about menopause and its effects. Our wonderful doctor was talking to us about what is menopause, and she gave a simple explanation to say its menstruation has stopped. So we're talking about menopause. Doctor, on this topic, I felt for us to actually fully understand menopause, maybe due to us not having enough time, I will want us to just zoom into the myths around it and demystify the many myths around it. Because as women, as I've said, menopause, when it's introduced to us, there's a lot of negativity around it, lot of fear that is instilled in a woman. That's why everyone knows about menopause. In boardrooms, when things are not going well with a woman, you'll hear the word menopause being thrown there. That's how much fear is being instilled. And me at my 40s, I'm always looking around and asking, when is this thing coming? So I
Yeah.
want, and how will I know when it has come? Because as you rightfully say, at times, the contraceptives that we use can stop our menstrual cycle, and I don't see my periods. Then I may not know. So when that word is thrown on the bedroom, in the boardroom, when I've said something and I'm told maybe you have reached your menopause, I start to be fearful. And I want us to look at the myths around it. We may not go through all of them. What I've done, I've looked at few of the myths, and you're welcome as part of this conversation. Please send through the myths that you have heard around issues of menopause. And I believe our doctor will be able to take us through so that we understand this thing, and get to now understand and be ready for it and take intentional decisions. Doctor, the first myth that I know, as you said, when you talk about ESCOM as switched, we tend to use that word somewhere as well.
Mm.
In menopause, that is the one thing that I know most women fear, that once you reach menopause, you will no longer enjoy your sex life. How true is it? What makes us to think that way?
Yeah. You know what? It's not a myth, actually. It's true.
Okay.
Um, so one of the things, so the ovaries is not just to bring about menses only, okay?
Mm.
So our ovaries and wombs are there for us to, prepare ourselves for production. You remember in the Bible, in Genesis, it said you will bear children. So the
Yes.
womb and ovaries, I mean, sometimes I wonder if the ovaries and the womb was created at that point when God said that, or was it created way before that? Sometimes I wonder when God said, now you're gonna bear children, then he put the womb there. So
Mm.
that is the main aim. So the ovaries also have other functions that support our bodies. They
Mm.
release hormones such as estrogen, progesterone, that are there to make sure that we have enough collagen in our body. That's our skins are like this. When we go into menopause, we start getting wrinkles. Where it also helps with the color of the hair. We start getting gray hair. We start getting even sometimes the people don't enjoy their sex life because even down there the vagina start becoming dry. Um, it keeps us moist. That's what that the hormones do. So when you reach menopause, also our mood, estrogen does a lot for our mood. It
mm,
elevates our mood. Those who are still going through the menstrual cycle, they know there are points where when they say "Utshwere PMS," he has PMS, because that time those hormones will be have gone down. The estrogen and
mm,
progesterone, they're down. The other hormones have gone up, and at that point, you start feeling sad. You cry easily. You get irritated. You get angry, and all that. So those things truly happen even in menopause. So you don't enjoy your sex life because you have less libido because the happy hormone, the estrogens are gone. So they're no longer there. So you have low sex drive or low libido. Some they actually start experiencing painful or uncomfortable sex because they have vaginal dryness. Some you get depressed. You are depressed most of the time. All the time now you are sad, you are angry.
mm,
Indeed, the boardroom things happen and can truly happen because of menopause. They
mm,
may be right that yay, police menopause, this one. These days
mm,
she's always angry, she's always shouting. It happens. Some they get to a point that there is proper depression. Like you don't find joy in anything. Everything
mm,
just makes you sad. I mean, people will say, but Mam Rulani, you are hosting a beautiful show, but you don't see anything positive about that
mm,
because of you around menopause. You see a lot of negativity, you know. And then the other thing that that may happen, you start also having low self-esteem because of the changes that are happening in your body. And also
mm,
weight gain. Weight gain is real at that age. That's why it's important to exercise and all that, because now you start having all the complications of weight gain, such as high blood diabetes and joint pains and all that. The joint pains can happen because of menopause. They can also happen because of the weight gain that comes during menopause.
mm,
The other thing is sleep disturbances. We always wonder why our parents are not sleeping. Why is the Gogo is not sleeping? Because his menopause. It can also disturb your sleep. You don't sleep well. Most of the women in their older age, they do not sleep.
mm,
They struggle to fall asleep. They sleep late, they wake up very early, and then when they are early, wake up early, very early, they start waking up everyone in the house, they expect everyone to be up. They don't understand why you're still sleeping.
mm,
So to be honest, those are actually the true things about menopause.
mm,
Um,
mm.
some are more severe in other people than the others because of
Yeah.
our lifestyle, because of how we are brought up, about our coping mechanisms. Some people, a small change in their body, they are
Mm,
miserable. While some people can go through a lot and they can cope well. So the coping mechanisms that we have learned over time as we're growing up also start to play a role. That's why you see some people do not cope well with menopause. Some people you never even tell that they've gone through menopause until they tell you that, because of how their bodies respond to these changes. So it's a stage
mm,
of life that really we should not be fearful of. If we are knowledgeable, we get prepared for it and we embrace it. Just like how we embrace starting menstruation, as a girl, you start to realize that my girl child is growing. Even as a woman, you start to realize I am growing. And I hope even men embrace the fact that their wives are growing. These are the
mm,
changes. They embrace the changes. You start starting to understand that it's not because they don't love you anymore that they try to avoid engaging in sexual activities more. It's because of their age, they're growing up, and you start, you know, introducing other forms of bonding in the relationship other than the sexual intercourse.
Wow. You've gone through all these different myths that we have. And what is scary is to when you say, they're right.
Unfortunately, they are right. But
They're right.
yes, and we as gynaes, we are here to make it bearable. You understand? We are here to make it bearable. You do not have to suffer alone. You do not have to not enjoy life anymore. We are here to support you, are here to make sure you cope with all those symptoms. Most of those symptoms we can there's treatment for them. So yeah, we are here to help you women go through menopause. That's why we are here. Yeah. I don't think anyone wants to be, a thorn in people's bedrooms. Every time you open your mouth like, oh, there she's coming. No.
And when you talk about elderly women not sleeping, wanting everyone to be out and about,
Yeah.
and those are things that we're seeing, and we tend to complain about them. And that's why, as Prudent Women, we're having this conversation. We say we want to talk about things that will empower us on how to respond to them and improve the quality of life for our loved ones. So I believe if you are a woman and you are at that stage, now you understand that you are not doing it out of just being wanting to irritate people, but it's because of the stage that you are at. And when you embrace it and manage it properly, you'll be able to have a good quality of life. Even as Dr. Chehu is saying, she's here as a guide to help us cope with it, to make sure that it's not something that takes away the quality of our lives, but we have things that can be done. And as we continue the conversation, she's going to take us through what is it that can be done for us to be able to manage this stage. But Dr. Chehu, before we go on an ad break, I see there's a question here. We're talking about the different myths. Someone asking, what about the sweating?
That one is actually the number one symptom that women experience. It's called hot flashes, because how it comes is like you feel like there's heat, a lot of heat at the same time, and then it disappears. Then there's heat, and then this symptoms makes people fight in offices, because someone will get in, they switch on their aircon, and then when they go up, people say, we are feeling cold, switch it off, they come back, and and sometimes that is actually one of the first symptoms. You're still seeing your periods, maybe they're irregular or whatnot, but you start having this hot flashes. You get in, you want to switch on the aircon, the other people want to switch it off. It may be one of the first signs. So hot flashes, yes, is one
They
of
are real.
it's real. It's one of the main symptoms. Actually, about 74% of women experience that. Yeah. It's just some cope with it better than the others. Some it also helps where you are, if you are in colder climates and whatnot, you may not really feel it as much as somebody. Imagine getting hot flashes while you are in Limpopo,
Yeah,
While you're in
that
Messina and you're having hot flashes. I don't know how people survive
how we
there. Yeah, but some people cope with it better than the others. Some is also some coping mechanisms. They don't really pay much attention to the sweating. They focus on whatever they are doing. Some it really, really bothers them. They become dysfunctional because of that constant sweating. So hot flashes is there. It's the main
they are there.
symptom, really. Yeah.
Okay. We are talking about menopause and its effects, and this is Prudent Woman on Bold Moves Radio. I will want us to go on an ad break. When we come back, Dr. Chehu is going to take us through how can we now cope with it, because we had all these myths, all these things that are being thrown at us in the boardrooms. Unfortunately, it's what menopause is all about. All we need to do is to find ways on coping around them and improve the quality of our lives. Let us go on an ad break.
Are you ready for the ultimate dietary powerhouse? Look no further than Masana Dietitian's Nutro Boost. Our scientifically formulated low GI food is designed to give you the boost you need to fuel your body and reach your health goals. With NutriBoost, you have the flexibility to enjoy it as a high-fiber cereal or a satisfying shake. Simply mix it with water and indulge in the mouth-watering flavors that we have to offer. But that's not all. NutriBoost is packed with essential nutrients that are beneficial for your overall well-being. Enriched with 20 immune-boosting vitamins and minerals, it's a convenient and effective way to support your immune system. And here's the best part. NutriBoost is gluten-free, egg-free, and high in omega-3, making it suitable for those with dietary restrictions or allergies. Need an energy boost? NutriBoost has you covered. It's high in energy and protein, providing you with the fuel you need to power through your day. Whether it's a busy morning or an intense workout session, say goodbye to midday slumps and hello to sustained energy with NutriBoost. Try it today and experience the difference. For orders or to become a distributor, contact us on the following details.
You are listening to Bold Moves Radio. The show is Prudent Woman with myself. I'm Rhulani Baloyi. This afternoon we have our good doctor, Dr. Tshegofatso. She's a gynae. She has joined us. We are having a conversation about menopause and its effect. If you have just joined us, she took us through what menopause is and quite a number of myths which we thought were myths. She took us through all those symptoms to show us that indeed those are the signs of menopause. And menopause is just menstruation has stopped, which means once you no longer have your periods, not being induced by any other thing, but naturally or through other medical procedures that you may have had, which makes it for you not to be able to have periods, you have reached a stage of menopause. Dr. Tshegofatso, you took us through a number of symptoms that one may have that shows that you have reached the stage of menopause. And you, in your explanation, in your definition, you took us through when can one expect to have menopause. You spoke about premenopause and all that. But I want us now to look at the effect of menopause based on your your biological your inheritance. Can I inherit it from my parents, or is it something that just happens to each one of us, or it is linked, more especially when you talk symptoms, when you talk when can I go on menopause and all that?
I just want to put it out there that all of us, all women, we're gonna go through menopause. We're gonna go through it. Yeah, unless if we've never experienced having menstruation, having those hormones. You know, there's some conditions whereby you don't, you have problem with producing the hormones like estrogen and progesterone. But for all of us, who are growing well, had all these hormones, we went through our menstrual cycles all our lives, we're gonna reach menopause. Even me as a gynae, I'm not exempted. Even no matter how well anointed you are, you're gonna go through menopause. It's a stage of life that we all gonna go through. And the reason why we all go through menopause is because when we are born, when a girl child is born, you are born with follicles or small eggs in our ovaries, small eggs, multiple eggs. Can be as many as 500,000 in our ovaries. And those eggs are there to sustain us all our lives. So they'll get a time where they get depleted. As you know, even if you have a lot of money, if you're not making more, it's gonna get depleted at some point. So same thing, we don't get to make more as women. The ones that you're born with, those are the ones that will sustain you for all your lives. And from the age of 13 onwards, when you start your periods, every month, about 15 to 20 are being recruited. They're being used up. That's why when you reach the age of 45, they are now finished, or they're starting to finish. So that's why we go through menopause. And the thing is, those follicles or those small eggs release hormones called estrogen and progesterone. And those hormones have a lot of benefit beyond just maybe helping pregnancy, such as They support our skin, they increase collagen. So that's why most women, we have nice skin, nice firm skin. But when you become older, you start having wrinkles. And then the other thing that it helps is keep our bones strong. And then the other thing that it does, it keeps the vagina like well and moist so that we don't have like painful intercourse. Um, it does a whole lot of things, It helps regulate the temperature in our bodies. That's why when we get to menopause, we start having hot flashes because our body is just confused, does not know how to regulate the temperature anymore, you know. That's why it's very important when you get to menopause, your lifestyle, you really adjust it because you need all those calciums to support the bones because there's no longer estrogen to support them to keep them strong. Your diet it becomes very important. It also helps with your metabolism. That's why you're able to regulate weight. The things that we eat nowadays, honestly, if there was no this estrogen and whatnot, we could be even way overweight than we are currently. So it really help us. So we all gonna go through menopause.
But we
And
all
then the
go
other
through
thing,
menopause. Yes,
yeah,
let me not
sorry,
disturb
sorry
you.
about it. Not to go back to the question, can you inherit it? So I was answering that it's a phase, just a stage that you're going. It's not because your grandmother did this and that. The only
Mm,
thing is that maybe there's a genetic component to it, whereby maybe if your grandfather or grandmother got it at the age of 50, you may get it at the age of 50. But the problem is there's a whole lot of things that influence menopause other than just your genetics or your family background. It includes your diet, it includes your lifestyle. Are you exercising? Are you eating well? Are there other hormones? Do you have any other medical conditions that are affecting the functionality of your ovaries? The production of, I mean, the function of those eggs. So those are the things that you may not necessarily reach menopause at the same age as your mother, or your grandmother. You may reach it earlier or you may reach it later because there's a whole lot of things that influence it other than just what happens in your family.
Wow, we are talking about menopause and its effects. And this is Prudent Woman on Bold Moves Radio. We have our lovely doctor, Dr. Sekhaolelo, who has joined us. She's a gynae who's talking to us around the issues of menopause. Doctor, someone is asking me on the platform to ask you if there's a similar condition for men.
I would like to believe because sometimes they tend to, what do you call it, have similar symptoms. So we tend to say they're having andropause. When it's men, it's called andropause that they may be
Oh,
having, but it's not as what do you call it? It's not as severe or as common
mm,
as as you have it in women. Women, because men constantly have a supply, like every month they are producing these hormones. They are
mm,
producing, but they're producing all this. But when it comes to women, we are born with a supply. We are given our whole supply to say, go and see how you manage. I think that is also the other reason why women can manage money, the finances of the families well, because they're used to being given a bulk and you sort yourself for the rest of your
yeah,
life.
yeah,
So, yeah, I think it was built in us. But for men, they are constantly producing all their life. That's why you can have a 90-year-old man still functional, still having children, because they
okay.
are constantly producing. As long as they are healthy, they are well, they are active, they can still produce. So the thing that causes men to also start having issues is
Mm,
those things that I talked about, the lifestyle, they are
mm,
yeah, things like smoking, they affect your reproductive life.
mm, mm.
So Some women, yes, can reach it because of their lifestyle, their behavior, the things that they do, whether they're active or not. But it's not a stage, it's not a must like in women that we know you're gonna deplete at some point.
Okay, so men continue to produce, women, because we got the supply when we came to this earth, it gets finished and we reach that state.
Yeah.
Wow. We are talking about menopause, and you said for men is andropause,
Yes.
which is not a must. You may have just the symptoms. We are talking about menopause specifically on women and its effect. And I see someone here saying, okay, we're going to move on to this one. Now we've spoken about menopause, doctor, and you've given us the different symptoms that one may experience to show that they've reached menopause. And you said that's the reason you are here as a gynae, to make sure that you help us to cope with the condition. It's a must, we shall reach it. But their medical science has made research and has got something to help us cope with it. What is it that you can do for one who's saying, I'm not coping with all these symptoms, I'm coming to you? When can you suggest or recommend that I seek medical attention? And what type of medical attention should one seek when they are not coping with the symptoms?
So, before I go into that, I want to also discuss a bit of concept of pre-menopause or perimenopause. So
Okay.
before you actually reach your final menstrual period, whereby you have your period and then you stop for 12 months, there are changes that may happen. You know, just like when you are starting your periods, they start off not being regular. You find that you menstruate for like 8, 10 days, and then periods come when you least expect them, they become uncomfortable. So even towards the end of your period, which is towards when you're heading towards menopause, you get a lot of women around their 40s coming to consult because they are having abnormal periods. All of a sudden, their menses were going well every month. They knew when they were coming, and then they start having irregular menses. They may have menstrual periods or in 1 month, few days apart, and they may have menstruate longer days than they used to. They'll come and say, I've been menstruating for 2 weeks. This is very unusual. I used to go for my periods for 4 days, or I'm having very heavy menses. So those are the things that may show that you are also you're heading towards menopause. And sometimes it's so bad that women they need to get blood. They need to be transfused with blood because the bleeding is so heavy. They're finishing the blood in their body. So those are the things that you should consult for. You should not bleed so much and just sit at home. And then the other thing is once you are reaching menopause, you're starting to experience those symptoms of you're becoming irritable, there is hot flashes and all that. You can come consult and we see if they are what do you call it? There are things that we can do for you. One of the things that we recommend is lifestyle modification. So some people, they start to cope better with the symptoms when they start exercising. As you know, when you exercise, you sleep better at night. Um, you sleep better at night, you're more active, you're more energetic. Exercising releases hormones called things called endorphins, and endorphins are happy hormones, so they may help to boost your mood, when menopause is no longer giving you a great mood. So lifestyle modification, eating well, having the right nutrition, it helps to, as you know, if you eat well, if you tend to have energy during the day, you tend to be happier, your skin tends to do better, your mood tends to do better, you sleep better when you eat well, it's things like caffeine and all the junk food that we eat, oily food that makes us not to sleep better at night as well. So lifestyle modification. And then there are certain things, there are some women that say, I don't want medication, I don't want pills and all that. So there are things we can refer you to a psychologist to do cognitive behavior therapy, whereby they teach you when you start having that hot flashes, that heat, this is how you must deal with it psychologically. They teach you, you focus on something else, or you think about something else. You take your attention away from the actual what do you call it, the sweating and all that. So psychologists also do play a role in helping to deal with the symptoms of menopause, especially if you don't want any medications or on you. And then there are other medications that are not hormonal, that people, because they're afraid of taking hormones for whatever reason. So, for example, if you are having issues with um, low mood because of what do you call it, low mood because of menopause, we can give you like antidepressants that helps to elevate the mood. And then the other thing that you can give if you're having like vaginal dryness because of menopause, you can use just normal water-based, lubricant that is not it does not have any hormones, so that you can have comfortable sexual intercourse. The other things is, for example, you can start taking calciums to help your bones stay strong, to help your skin. So supplements, multivitamin supplements, they also can assist. And then there are those that prefer like herbal-like medications. So there's things like evening primrose oil that has properties that are the same as the estrogens, the hormones. Um, you can use, you can prescribe, and then you use them. They can help improve those symptoms of hot flashes, moods, and irritability and sleep disturbances. And then there are also hormonal therapy. Remember, I said the ovary produces estrogen and progesterone. So we can actually give you an estrogen and then you get your function back. It doesn't make the ovary function again, but now we are giving it to you. And then those estrogens it will help you, it will help alleviate those problems of not able to regulate the temperature in your body, which means it will take away the hot flashes. It can help prevent your bones from being weak, because when you get older, a simple fall, you can end up actually breaking your bone simply because it's gone weak. And I really recommend those people that reach menopause early or premature menopause, those who reach menopause before the age of 40, or those that reach between the age of 40 and 45, to consider this hormonal therapy, because they are at risk as they grow older. They become more and more at risk of um, their bones breaking. They suffer from these symptoms for a longer period of time. And the symptoms of menopause can last for 7 to 10 years. You can have all these hot flashes for 7 to 10 years. Some people over the years, they develop coping mechanisms. They don't have a problem with it. Some, they have it all this 7 to 10 years. And then some actually have it for a shorter period of time, because we are not the same, you know. So if you are able to cope, sometimes we put patients on hormonal therapy, and then they take it and we see how long are they coping without it. If they're not, we just continue it until that time that they can cope or the symptoms are no longer there. So the hormonal therapy, we can give estrogen only. Estrogen only is for those that have already removed their wombs for whatever reason. If they removed their wombs because of fibroids or other stuff, when they have reached menopause, we can give them estrogen only. And for those that still have wombs, we can give them combined therapy, the one that has estrogen and progesterone together, so that we prevent the risk of having endometrial cancer. And I know there's this myths out there that, or there's this, people are worried because there's this thing that this hormonal therapy causes cancer, breast cancer.
That
So,
was that. We had a question on the platform from one of the viewers
yeah,
about it causing cancer.
yeah, it's because when this what do you call it, when the hormonal therapy came in, and there was I think there was a study that came out and said this causes cancer. And that gave everyone a scare. But research over the years has shown that the estrogen only does not increase the risk of having breast cancer, unless if you are having the risk of cancer, like from your family history, it may just worsen it, but other than that, it does not. The hormonal therapy doesn't increase the risk of cancer. It is the one that can increase that has been shown to increase the risk of cancer is the one that is the combined therapy, though the number is quite small. Like the patients that have been found to have now cancer because of it's very small number. So it does not warrant one to be denied hormonal therapy because you think they have the risk, unless if they have a risk of hormone dependent cancers. Like if you have already had ovarian cancer that was there's what do you call it, of hormonal dependent cancers, that the cancers grow because of the hormones. So that means if you give someone those hormones, then the cancers will grow even more. So it does not. So people should not be afraid of this hormonal therapy. There are quite a lot of benefits for it.
Thank you so much, Doctor, for taking us through this conversation. It's opening our eyes to realize, as you were taking us through, what type of medical help should one seek. I'm realizing that all that we need to do is to be able to consult, and when we consult, we tell what is it that we need help on. Because what you are saying, talking about getting supplements for calcium to strengthen your bones, anyone can ask for such, at any stage. But then what it's saying is, when you are having menopause, just be able to identify all the different things that are making you not to have a good quality of life, and seek medical help, and they will be able to assist. You spoke about having to consult a psychologist, because one of the symptoms that you spoke about was always being irritable, then they will be able to take you through how to cope with such conditions that you're facing. Thank you very much. Because at times, because of lack of knowledge, one struggles with certain symptoms, and you are saying you can have it for 10 years. I can just imagine, if you are having hot flashes for 10 years, there's no way you can be having a good life. And we spoke about your sex life. You say there are things that one can use to make sure that you improve your quality of life, because it does not have to be the end. So what I'm basically getting from our conversation here is that all those symptoms, there's something that can be done, as long as you identify what the problem is, and you can find a way of minimizing their impact on your life. As a woman who has reached menopause, we do not have to be fearful. We do not have to hide, because, Doc, this thing, menopause, at times people are even ashamed, when it's said. You don't want people to know you have reached that stage, because you think people will diagnose you with all these different symptoms, and they may not take you serious. They may be thinking you are no longer a woman enough, and all these things. So as you were taking us through, I noticed that there is no need to be fearful, because it's something that we all have to go through. Just like all of us, we have to die at some point. So as a woman, it is appointed that all those eggs will finish at some point. And all that I need to do is to seek help, to be able to make sure that I improve the quality of my life. Thank you very much. And I see our listeners and our viewers on the platform, they're appreciating the conversation, appreciating the knowledge that you have given us this afternoon as Prudent Woman. And I see a question here, Doc, about it's about treatment. And what do you suggest? It's about the viewer is asking, is there anything that one can do at a younger age maybe to advise our young women at things that one can do to make sure that they don't reach menopause early, or even if they reach menopause, they lessen the effect of the symptoms? That's the question.
Uh, like I said, menopause or this our reproductive life is actually influenced by our lifestyle. If you're smoking, you obese, you're not exercising, you're not eating well, it may affect. That's why a lot of people say I'm having hormonal imbalance and all that. Yes, the hormones can become dysfunctional because of your lifestyle, because you're overweight, because you're not exercising, you're not healthy. So, in order to allow the hormones to progress well, naturally over the years, having a healthy lifestyle really, really plays a role. And people take it lightly. Like you may find somebody struggling to fall pregnant or something like that. You tell them go lose weight, and they feel like, hey, this doctor is wasting my time. It's because of how much lifestyle has an impact on our health, our health overall, over everything, even our reproductive health. So for us to be able to cope with the symptoms better, I advise that in our younger age, let's, keep a healthy lifestyle. It may allow us to be able to cope with menopause better. But because of our genetics, some may have more hot flashes than the others. Some may not even experience anything. You may not even think they've gone through menopause. But all I can say is that as a woman, when you go through all these stages, like I always say, when a girl starts her menses, bring her to a gynae for a consult so that we explain the changes that she may go through so that they are aware of what is normal and what is abnormal and when to come back, Because what I've realized is people live with these symptoms, or someone may experience menopause quite uh, early, maybe they have it in their 40s, and then they end up having um, complications later on in life. Like, for example, they've not been supplementing with calciums and all that, and then their bones become friable later on in life. But should that woman have consulted when they're starting menopause to say, I'm 40 and I've just started menopause. What should I do? Then you can advise that because you reached it at this stage, because you're experiencing these symptoms, this is what you should do so that you can live longer quality life all your lives. So do not suffer in silence. Um, we are here to work. Health professionals are here to walk this journey with you, to take you through, to tell you because of what you're having now, because of this timing that you're having all this may have this kind of impact on you in the next whatever years. So we recommend follow this lifestyle.
Unfortunately, all the medical practitioners that come through always talk to us about exercise and living a good, eating healthy. Exercise and eating healthy. It seems like there's no other magic. All we need to do is to eat well and exercise. That's all that all the medical practitioners always tell us. There is no magic. And that's what he's saying: eat well and exercise in order for you to be able to deal with menopause later, not to induce you said premenopausal stage because of your lifestyle and all that. Thank you very much, Dr. Chiho. We had a wonderful time with you, and we appreciate you taking your time to educate us around all these issues that face us as women and even for our loved ones. As you said, even our young girls, when they reach that stage, when they go through menstruation, it's very important we take them to a gynae and explain these things for them to understand what it means. Unfortunately, with us back then, we did not know all these medical practitioners. Some of us never even visited a gynae, but we now know that it's important and you do not need to sit all by yourself, because even if you are coping, she says you may experience other complications at a later stage. So it's very important to consult your medical practitioner. Thank you very much. We always say, as Prudent Woman, the time is not enough. It's an hour. it goes very fast. We do not finish our conversation, and you'll agree with me, through our talk behind the scenes, we could not finish everything. But we always believe that we spark conversations. As we've spoken about it, those who want to be prudent in their way of life, they will go and research more. Some of us may go and consult our gynecologist to be able to be taken through and to be ascertained what we are feeling. Can it be, lessened? Is there anything that can be done for us to lessen the burden that we're carrying? Because as she said, you do not have to carry it by yourself, but they are there as medical practitioners to give you some sort of relief. Thank you very much for this conversation, Dr. Chihu. But I do not want us to end this conversation as a gynecologist and an ops. I will want to give you this time to say anything in the medical field that you want us to be aware of at the present moment as women, either that affects us or our loved ones. As women, we carry our families.
Okay. Firstly, lastly, because I've been saying a lot, women empowerment, honestly, cannot happen in isolation. So when you're going through all these health changes, when you're going through these consultations, I recommend sometimes bring your partners, because you go through these changes. I'll explain to you, you understand well. When you go home and you try to explain, they do not understand what you're talking about. They don't believe you. It's like as if you're making excuses. So I always say in women empowerment, we still have to bring the men along because we are not living in isolation. We are not just women living alone in our own planet. We are still living with the males. So they need to understand those mood changes, because that's why we are now seeing a lot of divorces, happening at later on in life. Feel like these people have been together for 30 years. They are 45, they are heading towards retirement. Why are they divorcing now? Sometimes it can be simple things like this, this changes that a woman is going through, and it seems like you are not happy about anything in life. You're not happy about the marriage, and the man decides, okay, it's better that I leave, or the woman says, let me leave. Sometimes it's just the physiological changes that are happening, not necessarily that there's something wrong with the marriage now. So I advocate that when you're going through all these changes and you're coming for consultation, please come with your partners. Yeah, as I said, I am at Gynified Practice. If you want to ask or you want to come for a consultation, you can check us on our WhatsApp number. We have a WhatsApp number whereby we book is 071 200 3933. And if you're not sure whether you need to consult for certain issues, you can WhatsApp me on 064 558 5379. 064 558 5379. You can ask, I have this, do I need to consult or whatnot? And then you can schedule your appointment with your gynae, or you can schedule your appointment with us at Gynified. So feel free. We can also send us an email at info@gynified.co.za. I'm also there on social media on my Facebook page. I'm also there. I'm Tshegofatso, Josephine Sekhaolelo on Facebook. I'm also there on Instagram as TshegoNJ, and on Twitter, not Twitter, on TikTok as TshegoNJ. So please feel free to contact me there if you're not sure whether you need to go consult or it's normal or abnormal. You can contact me there.
Thank you so much for the wonderful time that we have had with you, and our listeners and our viewers are appreciating the session and the knowledge that you have imparted on us. Thank you very much, Dr. Chihu. May the Lord bless you. Even as women, we take our health serious and be able to come through to you. And as you said, we should bring our partners along, because at times we go all by ourselves, as you say, but it needs both of us, because when it comes to health issues, you need that support from your loved ones. Thank you very much for this time. And to all our listeners and our viewers, thank you very much, and for your interactions, your questions that came through. This would not have been a conversation without you. And to our technical team, DJ Messi, thank you very much. And our executive producer, Pastor Strike Mangani, would like to say thank you for giving us an opportunity to have this session where we empower each other to become prudent. And as Bold Moves Radio would like to say to all of you who have been part of this conversation, if you have not yet subscribed to our YouTube channel, please go ahead and subscribe, because we've got quite a number of other programs that we bring to empower us as society, because the word of God says, my people are destroyed for lack of knowledge. Just now at 5:30 on this very platform, we have the living word with our favorite pastor, Pastor Fridama Tebula, at 5:30. And on Tuesday, we've got the African Experience. On Fridays, we've got Apostle Joshua with the Kingdom Impact. As for us, Prudent Woman, we'll see you next week, Sunday, from 4 o'clock up until 5 o'clock, even as we become prudent together. Have a blessed week ahead and enjoy yourselves, even as we celebrate our Heritage Month on Tuesday. And all of you who have taken your leaves, enjoy yourselves and have a blessed week ahead.